Kimberly Hanson, our next speaker, is the Executive Director of Federal Affairs at Diabetes Canada. She is responsible for advocacy with the federal government and on national issues. She has been instrumental in bringing forward the need for a national strategy for diabetes in Canada, which has most recently resulted in a substantial government financial investment in a national framework, and a supportive Bill C-234 being passed, which is an act, again, to establish a national framework for diabetes. We are glad to have Kimberly here with us today to talk about the strategy and journey that Diabetes Canada has taken so that we can learn as we start our own path to addressing Parkinson's.
Thanks so much, Cameron. I'm so thrilled to be here with you all today, and I'm really looking forward to the Q&A period, so I'm going to try to whip fairly quickly through my slides. I wanted to start by just sort of positioning us. Any advocacy campaign needs to start in defining what the problem is. And in the case of diabetes, it's really a problem that's getting markedly worse all the time. I myself live with type 1 diabetes, and when I was diagnosed 25 years ago, I was one of 1 million Canadians living with the disease. Now I'm one of 5.5 million. So the growth curve is really exponential, such that diabetes or prediabetes now directly affect 1 in 3 Canadians. And every 24 hours, the cost of the disease is very high. More than 20 Canadians die of diabetes and its complications. 14 have lower limb amputations. And yet 620 more people fall into the diabetes pool, so to speak, every day in Canada by receiving a diagnosis of diabetes. COVID has made the situation worse. People with diabetes are not at greater risk of catching COVID, but we are at significantly greater risk of severe disease or hospitalization or death if we do catch it. And in fact, COVID seems to be triggering new onset diabetes in a number of cases. Something about how our immune systems are reacting to the disease is causing mixed signals that are resulting in some cases in diabetes. And so the main message for us is that unless and until we reduce the burden of diabetes and other chronic disease, we're going to struggle to cope with this or any other infectious disease burden. And I point this out both sort of for information, but also because I would say that this is a fact that helped us keep our campaign for a national diabetes strategy current and top of mind, even during the pandemic. We began our journey towards a diabetes strategy in September 2017 with a multi-sectoral roundtable, kind of an art of the possible session that featured people from other patient groups, from academia, clinicians, industry, who all came together to say, could we adopt the framework that was used in the case of HIV/AIDS, the 90-90-90 target, for the case of diabetes? Can we use what worked in the case of a disease like HIV/AIDS for a non-communicable disease or a socially communicable disease, depending on who you talk to, like diabetes? And the answer in that session was yes. So we got together a working group, series of working groups, including 120 people from all those sectors, who worked through the first half of 2018 to shape the framework that became Diabetes 360. And I'll tell you what that is and why it's called that in a moment. That led to a recommendation to the federal government in July of 2018 that they fund the program. We spent 2018 and 19 really just focusing on advocating both with the federal government and with provincial and territorial governments, which was an important part of our approach. We had to be sort of going both top down and bottom up in order to connect all the dots and build the sort of will politically to do this. We then took it kind of a step further and brought representatives, like at the deputy minister level, of every province and territory together with some of the key federal agencies and pan-Canadian health organizations at roundtables. One was in person, one was virtual during COVID, to say, how could we collaborate to make this real? And we think that the combination of all those things resulted in 2 great wins this year. One was the federal budget commitment to implementing a diabetes framework. that was received in April. And the second was the passage of Bill C-237 into law. That is an act to establish a national diabetes framework, and it makes it law in Canada now that we must always have a diabetes framework, and we're really thrilled about that. I can't deny that the fact that 2021 is the 100th anniversary of the discovery of insulin in Canada probably played a part in us getting the sort of political will for these things in this year. What is Diabetes 360? Really, really briefly, it's a comprehensive framework comprised of 4 targets. And it's one that we call Diabetes 360, but it would actually help support most, if not all, chronic diseases and reduce the burden of them. The 4 targets are that starting from kind of the 9 p.m. to 12 a.m. position on the wheel, that 90% of Canadians should live in an environment that promotes wellness and does not promote the development of type 2 diabetes. So that's healthy eating, that's food security, income security, reducing environmental pollutions, building walkable communities. That 90% of people should be aware of their diabetes status. Right now in Canada, at least 1.5 million people have diabetes and don't know it. That means that they're presenting with complications already in place. We have to catch them sooner so that we can preserve their health. The third is that 90% of Canadians with diabetes are engaged in preventing complications. And so that's 3 kinds of categories of care. One is care in the classic healthcare system. We want to make sure that people are getting access to the right care at the right time, leveraging virtual and telehealth technologies to bring care to people where they live. The second is around self-management supports. And the slide that Sarah showed earlier of the many, many blue dots with the one red dot really resonated with me, because diabetes, like Parkinson's, is a very self-managed disease that requires a lot of knowledge on the part of, and a lot of supports on the part of the person living with the disease. And so that's about getting access to the medications, devices, supplies, and knowledge that we need to live well with diabetes. And then the third category is supports in the community. So I loved the initiative that I heard about earlier today of connecting people with Parkinson's to resources in their community that can support them. That is something that we're lacking in the diabetes community as well, and would be a game changer. So that's part of the recommendations there. The achievement of all 3 of those drive towards the fourth, which is that 90% of Canadians are engaged in these interventions are achieving improved health outcomes. This is really all about the patient. I should have said that of the 120 people that collaborated to develop this framework, 30 of them were people living with diabetes and patient advocates, or they're caregivers of people with diabetes. And so we really developed this in close collaboration with patient partners, which we believe helped make it a solution that the whole community could get behind. It contains lots of recommendations. I'll sort of skip through this because I've given you a bit of a flavor of that. We had lots of broad stakeholder support that we built over the couple of years we've been advocating for this, support at the federal level, provincial level, from healthcare providers. And we did a lot of polling and mobilizing the grassroots with letter writing campaigns and petitions to help make manifest the voice of the tens of thousands of Canadians that wanted this strategy. We recommend that in order to implement the strategy, a temporary center of expertise be established to help build a foundation of data, to help work with provinces and territories to implement the Diabetes 360 recommendations, and to facilitate the sharing of best practices to scale new approaches that are proven and working in one jurisdiction to another. We think that work will take about 7 years, and it'll cost about $150 million that we've asked for from the federal government. We haven't received all of that, but we're hoping that more will come from the initial investment that the government is making in this strategy. We think that $150 million could return $20 billion in savings to our economy over the same period of time by reducing the number of people that will develop type 2 diabetes. And about $11 billion of those savings accrue to healthcare systems, while $9 billion accrue to employers. I think it's important to remember whenever you're advocating for something that you're advocating to often politicians and decision makers who are influenced by the political cycle. And so that means that you need to be talking about what can be made manifest quite quickly. Politicians are sort of chronically interested with election periods and cycles and sort of 4-year terms. The other thing that you need to talk in terms of is what can they save with investing in your strategy. That's always important to government decision makers. We were thrilled when a private member's bill, Bill C-237, was introduced, and we were even more thrilled that, notwithstanding the pandemic and a really heavy agenda in Parliament, it was hastened through. It was carefully studied, both in the House of Commons and in the Senate, but unanimously passed, I think in recognition of the great burden that diabetes remains in Canada and of the need to really start to do something differently to bend this particular disease curve. And I think that by ensuring that the voice of the community is very loud and clear in all of our advocacy, by ensuring that we kind of spoke in the language that resonated with the decision makers, that we were kind of persistent and ever present in their thinking and in their decision making, we were able to continue to make progress towards this strategy, even in challenging times. And so I think that some of those are tips that I would offer to you guys in embracing your own advocacy approaches. I also think that something that I can't overstate the importance of is having partners from the patient group community. We were really fortunate to have support from heart and stroke, lung, kidney, cancer, who all helped step up and say, we see that you need this, we see that this will benefit our communities too, and so we stand in support with you. And I would hope that there's something, I would love it if there's something Diabetes Canada can do to support you all in your advocacy.